My name is Stephen Andracki. I'm a physician in Pahrump, Nevada, and I work there as a staff physician. Brain injury is a very vast description of anything that can happen to the head and to the brain. And so they can happen from birth, for instance, or they can be acquired, or something that happens from, most commonly, accidents. And so by far the most common causes of brain injury are auto accidents. And since we use seat belts and since we have airbags, we're being able to prevent a lot of head injuries and brain injuries. We've all heard about starring of the windshield, or when someone hits the windshield and breaks it up into lots of pieces. But that's less common. That is when people use their seat belts. Well, concussion is an interesting subject in itself. Concussion is just alteration in the function of the brain. It may or may not be associated with loss of consciousness. So there's not a whole lot we can do for concussions, and being checked out for concussions is probably not something you need to do right away. I think that in the field, if the ambulance responds to the scene, that they can pretty much determine whether it's significant injury. At some point, someone may need to be checked for concussion or residual for concussion, because it's not unusual to have headaches following concussion, or a lot of times the head injuries are considered to be minor and they don't require any special treatment. Well, part of my certification is a member of the Ringside Medicine. I'm board certified, so I've had a lot of training, probably more than most physicians, in head injuries. So taking boxing, for example, where especially young people are exposed to a lot of head injuries. The amateur boxing is different than the professional boxing, where you don't wear headgear. And so the facts for head injuries are: 1, they are serious and significant. 2 is that concussions are common with this. 3, if you do sustain a concussion, or a boxer does have a concussion, that is an automatic out. They cannot box, they cannot train for a period of time. Why? Because research has shown that if you suffer a concussion, that within a period of time, maybe 30 days, maybe 60 days, you have a second concussion, you can suffer from a death due to brain swelling. So this has become a much more important topic now. So this is why young people, especially, who have concussions associated with sport, really need to be checked out and really need to be seen by physicians or by trainers who are familiar with this. In terms of professional, which is the professional football players who suffer from most head injuries and concussions, that those players are now being studied more and more often from the cumulative effects of concussions. What's going to happen, it depends on how people want to watch sports, how much impact they have. The worst injuries that happen are with equestrian events, with horse riding, and that's why people riding a horse should wear helmets, because that's where you can fall the most and with the most force. For teens that are in sports, the important thing is change in behavior, change in their function, sleepiness. It's unlikely to find someone who's paralyzed. By the time that you can't move your arm, you have numbness, or you have unequal pupils, it's way too late. But personality changes are not an unusual finding in concussions, and headache symptoms, and also problems with light, for instance, that you'd expect with migraine headaches. Those are fairly significant. I think that should prompt a visit for further evaluation.